Hi, I'm Dr. Packer with Precision Spinal Care, and I just wanted to share with you a little bit about the types of services that we provide and who we are a good fit for, and maybe perhaps who we're not a good fit for. So, the things that we mainly deal with are people that are dealing with chronic pain, such as headache, neck pain, back pain, perhaps radiating pain from the spine, like something coming from your neck down your shoulder into your arm, numbness, tingling pain, or from your low back down your hip and down your leg, something like sciatica. Typically, what we don't do are specific extremity type injuries. Like if you have an injured elbow or a knee, that would be better fitted for a specialist like an orthopedic or somebody that deals with extremities. Our main focus and specialty is in the spine. The service that we provide that's really unique and different is the Nuka spinal procedure. Nuka stands for National Upper Cervical Chiropractic Association. It's a technique that's been around since the mid-60s. And it has a lot of peer-reviewed research behind it. But the thing that you just need to know is that it's gentle, it's safe, it's non-manipulation based, meaning there is no snapping, twisting, or torquing of the spine in any way. And it's all based on a very specific exam and calculations that we get from x-rays to determine where your spine alignment is off and how we can correct it. So again, it's typically these spine-related problems that we help best with. We also provide durable medical equipment, so things like orthotic bracing, TENS units. We also offer to our personal injury patients, we have physical therapy and massage services that are here on site. We also have them sometimes available for our regular patients as well. We are also a specialist in personal injury. So if you've recently been injured in an auto accident, we can help navigate all those muddy waters that it can deal with dealing with your health insurance, the auto insurance, the liability, the attorneys. I've been an expert witness in court multiple times. So it is one of our areas of specialty. So whether you treat with me or you just want to give us a call and ask any questions, if you've recently been involved in an auto accident, we're more than willing to help with that. Another unique aspect of our office is our focus on biomechanical spine pain. So anatomical spine pain examples would be like a herniated disc, a compressed nerve, and oftentimes people seek pain management, a neurosurgeon, orthopedic surgeon, spinal stenosis. We do have the ability to diagnose those things if they can be conservatively treated or refer out if not. But biomechanical pain is very common and often not diagnosed or misdiagnosed. And this is dealing with the spinal ligaments, altered joint motion. Very specific testing needs to be done. And that's where my medical credentials come in. I've done a 2-year fellowship in spine management that's recognized through SUNY Buffalo Jacobs School of Medicine. So my training allows me to be able to properly diagnose mechanical spine pain, which is, again, often caused by ligament tears or offset motion of the spine that could be triggering facet-oriented pain. Those are where your joints kind of fit together in your neck or your mid-back or low back. So we look at that. And again, spine pain, especially back and neck, is one of the main reasons people visit doctors. It's one of the main reasons for our opioid crisis and also why people file for disability. Because again, these mechanical spine problems often go misdiagnosed or not diagnosed at all. So again, that's what kind of makes us special and unique, is being able to properly diagnose and make appropriate treatment options for these patients. Another unique factor with Precision Spinal Care is we keep it real. Results are very important to us. That's why even with an accurate exam and a well thought out treatment program, it has to work for you. It has to get the results that you're expecting. So of course, expectations are discussed up front, and then realistic timeframes are set, with the average being about 30 days, meaning re-exams are performed on a regular basis, usually within 30 days of your first treatment, to evaluate, is the care working? We'll do all the orthopedic tests again, any other necessary imaging or tests that needs to be repeated to know not just that you're feeling better, but the underlying problem has actually been corrected and stabilized. And another unique factor is our goal is to be able to get you well as quick as possible and teach you how to maintain those results yourself. So you're not dependent on coming into the office month after month, year after year. But we have a transition strategy where shortly after, when you're improving, we're going to teach you the home stretches, the exercises, the habits that you need to do on your own. So we can phase out and you can take over and take care of yourself properly and see the results for years to come. They're not just temporary. So again, the best fit for us typically, if you want to consult with us, would be any spine related problem, let's say chronic neck pain, headaches, back pain, or radiating problems from the spine going down the shoulder, arm, or down into the hip or the leg. Again, probably who we are not an expert or the best office to treat you would be extremity only related problems like simply a shoulder, an elbow or wrist, a hand injury, knee injuries, foot, ankle. Those are best treated by other specialists or orthopedic doctors. Again, when you come into the office, it's also very important to us that we screen you to make sure you are in the right office. So based on our very thorough exam, we do look for the red flags, things like spinal instability, neurological deficits, any red flags upon our exam findings, a vascular problem, things that would not be best fit for conservative care with the spine. And what's great is we built wonderful relationships with my association with Chesapeake Regional Hospital, serving on the foundation board, and some of the fine doctors in this area that we work with. So we can at least pre-screen for those things and refer you out so you can get those things with the proper attention that would not be a fit for us to treat in our office. And again, the biggest difference or what makes us unique or different at Precision Spinal Care really is the relationships that we build with you, the time that myself as the doctor and the staff put into you. So you'll know when you come in for that first appointment, you're probably going to spend an hour and a half, 2 hours with us. We highly encourage you to bring prior medical records, prior medical imaging. We're going to take the time to sit down with you, really go over your past history, what's worked, what hasn't, what you're frustrated with, and listen and find out what your key concerns are and what you're looking for. And we'll guide our exams, our imaging, and our advice with only safe, effective treatment options that would be in your best interest, whether they be with us or we refer you to one of the medical providers that we have good relationships with, so you can get some answers and get care that would actually be effective for you. After we do a very thorough exam to find out what's going on, including orthopedic tests, neurological tests, imaging, when you come back after I've had a chance to study all those results, we're really going to answer 4 major questions. What's wrong? Can it be fixed? How long will it take? And of course, the almighty question, how much will it cost? So of course, we'll always address your insurance questions or out-of-pocket or cost questions as well. We also highly encourage for you to bring family members, anybody that's part of your care team at home or that is a big part of your life. We welcome them to come back for the results to see what's going on. And we're also big on sharing your medical records, with your permission, of course, with your primary care provider or other medical providers, so everyone's kept in the loop. One of the most frustrating things I've seen in healthcare is what we call silo care, meaning each doctor is in their own box. They see what they see for you, but they never share that information or communicate with your other doctors. And it can be very frustrating in terms of repeated tests, not sharing information, or making clinical decisions with not all the best information. So we really try to overcome those barriers and reach out to your other specialists, your primary care providers, so we can provide the best quality care for you with all your doctors communicating and being on the same page. So we're really excited to see if we can help you on this journey and help you get out of pain and get your life back. All you need to do is give our office a call, or you can fill out the information form, and one of our staff members will get with you shortly, and we'll be happy to answer any questions that you may have before coming in, or you can simply schedule an appointment, and I'm really excited to see if we can help you get better.